Thank you very much, Jackie, and I'd like to thank our sponsors for the opportunity to speak at this symposium. And it's been really great being involved in this document, learning from my colleagues and bringing my practice to the group as well. And I guess we can't talk about best practice in venous leg ulcer management if we don't talk about the patient and what are the opportunities for maximizing the role of patients in venous leg ulcer management and offering some self-care solutions. And I think it's fortuitous that this week happens to be Self-Care Week. I don't know if many of you are aware of that, but if you go to the selfcare.org website, there are some great resources there if you are doing any work about involving patients in your practice and developments. But I think there are other good reasons to think about involving patients, because all the evidence from patients and patient stories and feedback tells us that 50% of patients say that they're not as involved in their care as they'd like to be. So we need to listen to patients. We also need to think about what's out there to support us in terms of developing our business case for the opportunities around empowerment. And this document from 2014 talks about strengthening the role of patients in their own care. And it talks about patients as self-care experts. And what it says is it's essential for us to involve patients in the delivery of their care if we're to achieve high quality care and good outcomes for patients. And there's some great examples from developing countries. So in India, they developed champions in families to help people prevent coronary heart disease. And out in Africa, they significantly reduced infant mortality rates by engaging first-time mothers in maternity care. So there's a lot that we can learn from other countries. And the paper, or the report, offers opportunities for how we might tackle the rising burden of chronic disease that includes wounds. And I guess it's a very challenging time. I've worked in the health service for a very long time. In actual fact, I've realized last night I've been in the health service for 36 years. So that's a very long time, and I've seen lots of change, and I've seen lots of movement, and things go around and come back again. But I think the reality is that we're pretty much very stretched at the moment, and we need to make savings in the region of 20 billion by 2020. And I know my own organization, we've just been through a CQC inspection and we got outstanding, but we're still looking at where we can make cuts to services. And that's for an organization that's very, very well established and very well run. So where does leg ulcer costs feature in all of this? So it's estimated that the management of leg ulcers costs in the region of 600 million per annum. So, you know, people will look to us to see where we can make savings in our specialist area. And if we think about where those costs are, the majority of them, or up to 64%, are associated with the community nurses seeing patients. So that's the visits to the patients or the cost of running leg ulcer clinics. This other document is very good in help to develop a business case for self-care solutions. And this is a 2013 document, but it actually says that the NHS in England could release savings in the region of 4.4 billion if we adopt people-powered healthcare. And there's some really good stats in this document. It talks about what are the opportunities for involving patients, families, and whole communities. And I think that's really particularly a good point now when we talk about integrated care. We talk about our community nursing workforce is shrinking, and yet our patient populations are growing. So how can we link in with social care and communities of practice to improve leg ulcer management? And if we do all of that, that will reduce demands on traditional services. It means people will need fewer hospital appointments. It means that people, if we do well, won't end up in acute care. And it talks about self-management solutions in terms of planning, care planning with patients, and it talks about the importance of developing knowledge and skills and giving time to provide education for patients with health problems. So what are the patient benefits if we adopt patient empowerment and self-care solutions? Well, we know that patients do better when they're involved in their own care. And we know that patients are often more compliant and concordant with treatment care pathways if we give them choice and greater control over their care. We talk a lot about personalization, and when we had our CQC visit, they were very interested in how the care plans were personalized for patients. And of course, if we sit down and do our care plans for our venous leg ulcer patients with them, it's much more likely that they will be personalized. And of course, patients report much greater satisfaction if they've been involved in care and if they've been given the knowledge, the skills, and the education to make the choices. So what do we mean by self-care? Well, from the Self-Care Forum, we're offered this continuum, which starts with patients being able to care for themselves, right through on the continuum to patients needing full-time care, maybe in acute care, hospitalization. And in the middle, you'll see there's patients who have long-term conditions. And these are our leg ulcer patients. It's not unusual for people with venous leg ulcers to have episodes of reoccurrence despite wearing hosiery and best practice intervention. So on the self-care continuum, we need to think about how we can improve and empower patients by giving them confidence and supporting them so that we can help reduce their dependence on us as healthcare professionals. But self-care is happening already. In the last session, we talked about diabetes, and the average person with diabetes spends 6 hours in face-to-face care with a healthcare professional. But the choices that they make the rest of the time, the 8,754 hours, will determine the life expectancy and the quality of their life. So only when we help people make good choices and support them with their decisions can we really improve outcomes. So I think there's a lot to be learned from venous leg ulcer management and from care of people with diabetes. But I guess the DIY approach is not for everyone. And you know, some of you will be sitting there in the audience thinking about patients that you're managing out in the community or patients that come to your leg ulcer clinic, and you'll be thinking, well, I've tried absolutely everything in terms of getting these patients to do some self-care. So it's not for everyone, and we need to think about things like mental capacity when we're assessing patients for self-care. We need to make sure that we've got patient consent and that they know what they're consenting to. But we also need to think about things like patient dexterity, wound site, and how they access the wound. And we need to think about information and support for people. But I guess what do we need to think about as professionals? And I think sometimes the whole idea of self-care challenges our practice. And if I think about some of our community nurses and their schedules, sometimes they really don't have time to think about the number of patients they're seeing, and they'll have patient A down for compression bandaging Monday every week, or they'll have them down twice a week if the patient needs twice a week. And we don't actually think about, well, what are the opportunities here for us to spend some time educating that patient and maybe think about what are the solutions to involve the patient. So we need to think about our behavior and how we can change our behavior. And we need to let go of our dependence so we can reduce patient dependence. And that means focusing on education as well as the task of caring for the leg ulcer. And as we launch this best practice document, there is a section in it that talks about opportunities for self-care and patient involvement. And the recommendations are that we involve patients much earlier in their care so that we can promote a self-care approach. First-line therapy with hosiery kits where it's appropriate, and I know certainly back in my organisation we have a number of leg ulcer clinics that are well established, and we have a simple venous leg ulcer pathway and a complex venous leg ulcer pathway, and patients with simple venous leg ulcers have a silicone foam dressing and compression hosiery or compression hosiery kits. So it is first line for us for those patients. So I think we need to think about why we're doing what we're doing and how can we do it differently. And then for those patients who are more complicated or more complex, we could consider wraps for those patients. And we've had really good success with that approach as well. And then, of course, self-care in terms of how the patient cares for their skin, because it's not just the ulcer that we're looking to treat, we're looking to treat the whole leg. So if we do all of that, what we'll see is greater involvement from patients in their treatment decisions. And if we help patients to understand their underlying disease processes and why they're in compression and why they're in the level of compression that they're in, we're more likely to get a patient who's empowered, engaged, and who has a sense of, I can help myself. And we know that we can improve their outcomes and improve their outlook as well, so that we reduce dependence and patients spend less time in our care. So either the community nurse going to the patient or the patient travelling to the leg ulcer service. But don't take my word for it. You know, go out there and talk to your patients, and what patients will tell you is they do want to be involved in their care. They do want to know what the latest evidence is, the latest, the new technologies, and what the opportunities are. So we take this lovely gentleman here. He knew that as soon as he tried on the hosiery, he felt instant relief. He said being able to wear the hosiery kit rather than bandages made him feel more human, more normal and more civilized. And he was much more comfortable. And if you've got a patient who's happy and comfortable, then they're much more likely to be compliant with care. So hopefully I have presented compelling evidence to you that self-care solutions are part of best practice in venous leg ulcer management. They have health economic and patient benefits. They can improve patient outcomes, experience and patient satisfaction, increase treatment compliance, and reduce the demand for health care. And fundamentally, that's essential for survival of the health services going forward. Thank you very much.